Development of hybrid nanoparticle as a transfecting agent in ovarian cancer cell line. Aim to develop a hybrid nanoparticle as a transfecting agent for cancer cells and its efficacy analyzed in ovarian cancer cell and PA1. Objective to develop a hybrid nanoparticle with co-precipitation method and its nanoparticle and zeta potential is analyzed, and functional bonds has been analyzed using FTIR, that is Fourier transform infrared spectroscopy, to seed the PA1 and BMSE cells and to check its cytotoxicity using MTT assay, and to code the cells with FITC and analyze the flow cytometry to see the internalization of the nanoparticle, and the fluorescence image were obtained. Abstract: nanoparticle based non-viral gene delivery system has been widely used for treating the cancer cell due to its improved transfection efficacy. Here we have developed a hybrid nanoparticle, that is metal ion, that is calcium and magnesium, and cytosine organic using co-precipitation method. The developed nanoparticle includes calcium carbonate, magnesium carbonate, cytosine, calcium cytosine, magnesium cytosine, which are in the range of 148.5 nanometer, 8.4 nanometer, 2.4 nanometer, 332.3 nanometer and 48.7 nanometer respectively. The zeta potential is analyzed to find out the charge. FTIR analysis is done to ensure the chemical bond present in the molecule. The in vitro cytotoxicity in PA1 cancer cells and BMSE cells have been done using MTT assay. The developed nanoparticle restrict the cell proliferation in PA1 cells, whereas the cytotoxicity in stromal cells ensure the developed nanoparticle does not affect the normal cells in the body. FITC is encapsulated with hybrid nanoparticle, and transfection is carried out in PA1 cells to check its transfection efficiency. Flow cytometer is carried out to see the internalization of the nanoparticle within the cell, and the fluorescence image was obtained. Methodology includes the preparation of the nanoparticle, FTIR analysis, particle size and zeta potential analysis, cell preparation and treatment, in vitro cytotoxicity, ex vivo nanoparticle cell uptake study, FITC coating for cytosine, flow cytometer analysis. Nanoparticle size and zeta potential analysis is done to ensure the the developed nanoparticle are in nano size. Zeta potential ensures the charge on the nanoparticle. Calcium cytosine, magnesium cytosine have negative charge, whereas positive charge, and calcium carbonate, magnesium carbonate has negative charge, whereas cytosine is not charged. FTIR analysis is done to ensure the chemical bond in a molecule. Presence of peak at 339 centimeter inverse confirms the presence of cytosine, and the wavelength at 1450 to 600 nanometer confirms the presence of calcium salts like sodium and MTT assay is used to check the viability of the cells. Blue color confirms the presence of viable cell, whereas white color confirms the presence of non-viable cells. It has been clearly shown that calcium cytosine and magnesium cytosine has shown the viable cells in MSC cells. Thus, it has not reduced the cell proliferation, whereas in PA1 cells it has there is no viable cells in calcium cytosine and magnesium cytosine treated cells. MTT assay in PA1 cells, it has been shown that the calcium cytosine and magnesium cytosine has reduced the cell proliferation compared to that of the control, and this has higher toxicity to the cancer cell compared to the other nanoparticle. This is the PA1 cells after treating with the nanoparticle. It has been shown that the calcium cytosine and magnesium cytosine has lower cell have a less cell population. MTT assay in BMSE cells, it has been shown that magnesium cytosine, calcium cytosine has the same level of control like that of the control. Here we just justified that the hybrid nanoparticle does not affect the normal cells. This is the PMSE cells after treating with the nanoparticles. Calcium cytosine, magnesium cytosine have same level of cells as that of control. Flow cytometer analysis is done to check the internalization of the nanoparticle within the cell. Here we have checked the morphology of the viable cell, and the scatter plot was therefore used to select the viable cell population. mean fluorescence was seen, that magnesium chitosan show higher fluorescence than calcium chitosan and chitosan alone, and calcium chitosan have higher fluorescence than chitosan alone. This indicates that the calcium chitosan and magnesium chitosan shows higher transfection efficiency than the chitosan nanoparticle alone. Fluorescence image analysis has been done. Calcium chitosan and magnesium chitosan have higher transfection efficiency than the chitosan nanoparticle, and the green color shows the internalization of the nanoparticle with FITC coated with it. Discussion. The current study is to develop an improved non-viral transfection nanoparticle using nanotechnology. Here, chitosan has been widely used as a nanoparticle carrier among the non-viral transfecting agent. However, the transfection efficiency of chitosan is poor in cancer cell line. Hence, we have developed inorganic metal ions used inorganic metal ions such as magnesium, calcium, and sodium, which has played an important role in cellular ion channel mechanism. And the size of the nanoparticle should be within 100 nanometer. The flow cytometer data and transfection images of magnesium chitosan has higher transfection efficiency than chitosan and calcium chitosan nanoparticle in PM1 cells. This is due to their size, because the chitosan is just 2.4 nanometer and the magnesium chitosan is just 48.7 nanometer, and additionally the magnesium and calcium are important key regulators in cellular functions such as proliferation, differentiation, and apoptosis. Because of this nature, it has been shown a very good result. And further, the cancer cell, the anti-cancer activity of the chitosan present in the periphery of the nanoparticle induced apoptosis process further enhanced by the metal ion, that magnesium and calcium. This would be an additional reason for the improved uptake of magnesium chitosan and calcium chitosan nanoparticle in comparison to chitosan. Though the results are promising and improved transfection efficiency shown by the nanoparticle, further studies are required to confirm the efficacy of this nanoparticle, including the in vitro evaluation of different size of gene. Conclusion. We conclude that developed nanoparticle reduce the PM1 cancer cell proliferation and act as a transfecting agent. It shows the improved transfection efficiency in cancer cell line. Thus, it can be used as a drug as well as a drug carrier for cancer treatment and gene transfection. The hybrid nanoparticle does not reduce the mesenchymal stromal cell proliferation, and the cells are viable as in control. And it has reduced the cancer cell progression and increased the cell viability in BMSC cell. Further results empathize that the magnesium chitosan and calcium chitosan nanoparticle can be a better transfection agent for cancer therapy. Further exploration on this nanoparticle, such as varying the size or regulating the surface charges, may pave way to next generation targeting multifunctional nanoparticle for efficient therapeutic application. References. Thank you.